and welcome to Standard Precautions and Beyond, Conversations in Infection Prevention and Control, a podcast of the Alabama Regional Center for Infection Prevention and Control, Training and Technical Assistance, or the ARC IPC. Today, we're exploring the complex and close relationship between birds and humans through the lens of avian or bird flu and zoonotic diseases. Zoonotic diseases pose significant threats not only to avian populations, but also to human health. These diseases, which can jump from animals to humans, can lead to serious health crises, as we've seen with some past outbreaks. Join us now as we unravel some connections between wildlife, disease transmission, and its impact on our communities around Alabama. Joining us today are Drs. Dee Jones, Tony Frazier, and Wes Stubblefield. Dr. Dee Jones is a veterinarian with over a decade of experience serving patients here in Alabama and is currently the state public health veterinarian with the Alabama Department of Public Health, or ADPH. He assists in educating the public on safety and welfare concerning both domesticated and wild animals. Dr. Tony Frazier is also a veterinarian with over a decade of experience serving patients and looking out for animal welfare in Alabama. Dr. Frazier was also appointed state veterinarian on July 1st, 2001, after working with the Alabama Department of Agriculture and Industries as a veterinary medical officer. Both Dr. Jones and Dr. Frazier attended Auburn University College of Veterinary Medicine, and we're lucky to have their expertise with us today. Dr. Wes Stubblefield is a district medical officer with the Alabama Department of Public Health, covering the northern and northeastern districts, and practiced general pediatrics for over 14 years before joining ADPH. Dr. Stubblefield completed his MPH at UAB in 2018 and transitioned to a full-time public health role in 2021. And we're looking forward to his valuable insight here on the human connection here. Thank you all for joining us.
Thank you, Tessa. We're very appreciative of this opportunity to speak a little bit about avian influenza and the human-animal connection. And certainly these opportunities we value because it is very confusing. It's very complex. And sometimes it's very difficult to really know what you're reading.
Yeah, absolutely. It can be a dense subject. So I guess our first question really is going to be directed for our veterinarians. So what is avian influenza? We hear people call it bird flu. Is that the proper term for it? And how does it differ from, say, regular flu that we hear about every year?
Dr. Frazier, would you be willing to take the first stab at that?
Yeah, sure, for sure. Thank you again for having us from the Department of Agriculture. So avian influenza and bird flu is okay to use. It kind of gets grouped with several other diseases, but avian influenza is probably the more perfect or appropriate term. It's a type A virus that is seen in wild migratory birds and has been for many, many years, maybe even decades or generations. So it's a normal virus that's in those birds. It can occasionally move out of those wildlife birds into domestic birds. That is a rare event. And usually in the last, 30, 40, 50 years since USDA has been tracking this virus, you'll see this pattern of every 5 to 7 to 10 years as the migratory patterns move from Canada down to South America. You'll see that virus make its way from those wild birds to domestic birds in that normally consistent pattern of every 5 to 8 years or so.
Does avian influenza typically spread among birds in the way that we think of droplet precautions and things like that among humans, or what factors contribute to that transmission other than that kind of migratory flow?
Yeah, that's a great question, and it's important because generally avian influenza among wild birds and domestic birds is primarily spread through fecal droppings and leads to the ability for cross-contamination. Not quite as much as aerosol. It can be spread respiratory, saliva, and again, they don't quite have the sneezing and coughing episodes that humans do, but it can be spread that way. It can even be spread through the urine, but most commonly in wild birds and then to domestic birds, it's usually that fecal material that's contaminated or has the virus living in it, which can again survive in the environment, not forever, but if the conditions are cool and there's some moisture and organic material, then that virus can hang around for days to weeks in the environment.
Gotcha. So it's more of a dropping protocol instead of a droplet protocol.
Yes.
Makes sense. If a person were to see a bird sick with bird flu, would they be able to tell? How could they prevent that contact with that species that's infected? Or what do people need to be looking out for?
Yes, another great question. So back to the origin of the virus itself, it manifests in domestic birds. They usually don't have any signs. So it's adapted to those birds. They carry it, they transmit it, and generally they don't show any signs because it's really not making them sick. In the last few years, there has been a shift in that virus, and the virus can exhibit itself both in wild birds and domestic birds, kind of two broad ways, and that's what we call either low pathogenic avian influenza or highly pathogenic avian influenza. The low pathogenic strain of the virus usually doesn't present itself at all in migratory birds. They're not necessarily sick. So a couple of 3 years ago, 2022, the virus had shifted a little bit and was actually highly pathogenic in migratory birds. So to get to your question, we did see migratory and wild birds that were of several different manifestations. One would be dead. They were just found dead birds. Then they were sick, poor doing, not moving, even neurological signs, and that's what you'll see in wild domestic birds. I mean, wild bird. In domestic birds, the low pathogenic usually manifests again very low subtleties, a drop in egg production. They don't eat quite as well. Feed conversion is off, and you may not notice much anything else. The highly pathogenic again reaches those mortality rates of 90 to 100%. So you'll see dead birds pretty quickly, depressed, neurological signs. Again, drop in egg production will be significant. And the birds themselves, again, poor doing, depressed. There can be some respiratory signs, diarrhea, of course. So that's what you'll see. The public would more likely see this in wild birds. And if they do, they need to contact either Dr. Jones or myself at the Department of Agriculture, and we'll coordinate with some outreach.
So I guess we'll shift focus a little bit, Dr. Stubblefield, with a question about human health. What is the risk of bird flu to human health? Can you give us a little bit of oversight to how that strain can cross over and infect humans, and possibly what those symptoms would be, or how it could compare with other flu viruses in humans?
I think it's important. People may hear different terms to describe this virus. We've already talked about avian flu, bird flu. Technically, it's H5N1 type A, clade 2.3.4.4b. And this is the exact virus that's been circulating among these domesticated flocks and also the dairy herds and the few humans that have been infected. Influenza is typed by using this H and N, which are proteins. And the protein that the H attaches to is how the influenza gets into the cells. And those proteins are slightly different among birds and humans. But humans do express both types of proteins, but much less so than birds. And so bird influenza strains that are adapted to birds are not particularly well adapted to humans because humans have less of these particular receptors. But they can, especially with very close contact. And in the past, these H5N1 strains have been associated with very high mortality rates in previous outbreaks. This has not been the case with this particular virus, this particular clade that we discussed before. So we know that the viruses can cause human infection. And so far, these symptoms have been very mild, usually centered around red eyes or conjunctivitis, with possibly some other mild symptoms, including some mild fatigue, and possibly some what we call upper respiratory symptoms, or maybe a runny nose. But so far, that's the extent of the disease that we've seen in humans.
My next question would be, and this is really for everybody, just kind of expand on that. There's definitely been some talk around those in the poultry industry and the disease spreading there. And clearly you guys have given some reasonings around that, but could you guys expand more on why that could be and why those individuals are higher at risk?
We know that the approximation of people being closely associated with flocks and in this most recent case outbreak of in the dairy herds involves people being close to them. And that does not, and that's part of our challenge on our messaging, because for most people, they're not going to be exposed to any great extent to avian influenza viruses. And we know that certainly the poultry workers and the dairy workers are most at risk. But what I'd like to just follow up on a little bit about what Dr. Frazier's in Stubblefield said is one of the
Please.
challenges with any flu virus is the change. And that virus, and it's a perfect world when it's in one species, its intended species. And the concern is that virus, perhaps it knows that we like it in one intended species, and it says, no, you're not going. We're not going to allow that. So the ability to shift and to drift, and the drift would be a major change. And I think that's one of the components of why we're talking today is how does an avian influenza get into what is the risk to the human population? And we sum that up and recently over the last 15 to 20 years, the term that's been coined is One Health. And that's why we're fortunate today to be talking to human health side and animal health side, and how this all comes together to where it's not necessarily traditionally we've talked about one silo, like and doesn't communicate with another silo. So then in two independent or even three independent environmental and wildlife, it maybe even transcends animal and human, and also includes the environment. But I'd like to just kind of make that comment that that's what brings us all together, and hopefully understanding and mitigating the risk to people as well as animals.
Oh, absolutely. No, thank you for making that comment, Dr. Jones. And that kind of segues into my next question is, what can we do? How can we share this information more with people? What should people be looking out for? And what are places like Ag and Industries and ADPH doing in the area of One Health to help address this issue that people need to know about?
Tessa, this is Dr. Frazier. Let me say real quickly again to that point that the poultry industry for many years now has, in an attempt to do what you're asking here, their surveillance is a pretty wide net cast within the commercial poultry industry anyway. So what that means is a lot of birds are being tested on the commercial side, both that produce our eggs and our meat. Those birds are being tested often. Most all flocks are surveilled before they go to processing. The egg producers are being surveilled through both serology and PCR. So there's a pretty broad net cast to catch that. Also, USDA Wildlife Services, they're testing wild birds all the time. And then we communicate. Dr. Jones and his staff and my office, we certainly following this outbreak in the dairy cattle, we have a conference call once a week. It's a standing call that we share information. We try to get that out to stakeholders, the Poultry and Egg Association, and again the poultry meat that and the eggs that we have ready for us to consume is safe. Sick birds do not make their way into processing, and we share all this amongst our partners and certainly at Public Health. So one of the things that we spend a lot of time educating producers on is biosecurity, breaking that barrier that he mentioned about the interface between wildlife and domestic birds. We spend a lot of time educating those producers on the basics and the necessity of biosecurity. Then we've got to relay that information to our human counterparts, and I'll let Dr. Jones speak to that. But just wanted to point out that we meet frequently, we exchange. And then their surveillance is broad, going on all the time. And then biosecurity is high on our radar list for producer education.
Yeah, and I will just expand on that just briefly. That so for example, this latest virus drift into the cow population, dairy cattle specifically. As the Alabama Department of Public Health, we did reach out in with the help of the agricultural department in ag and industries, and we wanted to make them aware, and also wanted to make them aware that there was going to be PPE, personal protective equipment, available should that happen. I would like to say, and I think Dr. Frazier would appreciate this being said, that at this point we don't have any reason to believe that we have infected cows in the state. So a lot of what we're doing right now is planning, and we're using a lot of Dr. Frazier's experience and the ag department as a whole's experience on avian influenza in the poultry operations as the basis of going forward in our planning and preparing and ultimately protecting people.
And I might add that in the dairy situation, that's another curious phenomenon that's going on. But the systems that are in place currently, pasteurization of milk has been shown. FDA's done some studies, CDC, the meat from these dairy cattle, as pasteurization works and has an effect and denatures the virus. Again, it's critical and important that we get that information out. I would think that, quite honestly, that these viruses are just trying to complete their life cycles, and they're looking for the best way to do that. Dr. Jones alluded to that. And so, quite honestly, we think that it's not a matter of if, but when we see these spillover events. And so that behooves us to constantly train, prepare, meet. And I do agree with the One Health approach.
So I guess I'll leave us with one last kind of finish up question. Where else can people go for resources? What can they do to protect themselves? And Dr. Stubblefield, this may be more of a question directed at you as well. Is this something that people should pay extra attention to around the time that flu vaccinations become available this year, or something like that?
Yes, and that's a great question. So speaking, just back to the One Health approach, ADPH continues to, on the human health side, monitor discussion that's happening at the broader CDC. The CDC types these viruses, and they're looking for specific mutations. The mutations that would be concerning would be mutations that would adapt them to be more susceptible to crossing over to humans, to be more severe, and also to have resistance to our antivirals. We haven't seen those yet, and so the CDC continues to move on this continuum of a low risk to human health or a high risk to human health, and anywhere in between. And right now, we feel it's a low risk to human health. There have only been 13 human cases since April, and again, they've all been very mild. But remember, many people have been tested and monitored. So that's what CDC is doing, and we continue to discuss that on the human side. But the problem with flu, the virus, is that, like we've mentioned before, is that it likes to mutate. And the concern would be is that if a human being contracts seasonal flu and another flu at the same time, that those viruses could, what we call, reassort, meaning they could shift their genes around, and that could lead to an epidemic or potentially a pandemic. So I think it's very important for the population to understand that the CDC is monitoring this closely. They have a website located at CDC that gives an update every Thursday on the number of cases, and it links to agriculture sites as well. And also that we at Public Health are continuing to encourage everyone to consider their seasonal flu vaccine to make sure that they're protected against the flu for many reasons, not just avian flu. We know that there is no vaccine that's available for avian flu, but it will protect you potentially against seasonal flu and hopefully against that reassortment. And this goes for our workers in our poultry and dairy industries as well. We recommend the flu vaccine for anyone 6 months and up. But reassuringly to the population, there are closely matched candidate vaccine viruses that have been distributed to manufacturers and are ready to go in case this becomes a risk to human health.
Thank you for that, Dr. Stubblefield. Dr. Jones or Dr. Frazier, do you guys have any final thoughts?
Well, just very quickly, USDA, APHIS, APHIS would be, Veterinary Services has a great website that has, you know, information where the virus is in the dairy cattle and on poultry farms, good information. We have links to that on our website here at the Department of Agriculture, contacts for all of us. So those are good resources, and we appreciate the opportunity to be on the call today.
Thank you, Dr. Frazier. Dr. Jones, did you have any final thoughts?
No, I really don't. I would conclude by saying thank you. And in terms of human health, washing your hands is very important. So we don't ever want to leave without saying that. No matter how complex what we're fighting against, we know the very basics still work and still help prevent serious disease.
Yes, I agree. Thank y'all so much for sharing your knowledge with us, and hopefully we can get this out to people that it'll make a difference with. But thank you everyone for listening, and please tune in next time for another episode from Standard Precautions and Beyond: Conversations in Infection Prevention and Control.